want to do more for our service users. We want to do more for our communities. And in order to do that, we're thinking about service users, their families, their carers, the communities that they live in, and all of that is really about the whole population. So we want to improve what we offer to the populations that we serve. And that's why we're thinking about population health.
Because I live in Luton, there's a lot of problems on the street. There's a transient kind of population on the street that have visible mental health, and those needs don't really seem to be addressed. And I don't want the staff at ELFT to do that. I want them to kind of have the vision, a future vision of a healthy population, and match that to their need as a great worker and a great contributor, to match their talent to where those needs are needed. And I think the whole thing is it needs to be a joint exercise between people that run the service, people that use the service, people that work in the service. And that's the key thing.
It's very difficult to think about supporting people with mental health problems if you're not also thinking about their social circumstances, stability of housing, whether or not they have support with meaningful activity like a job during the day, the nature of relationships. And I guess that, traditionally that's the sort of stuff that we've done, so we have a really good platform to build on. It's about taking that further and into the next steps of focus. Life expectancy, for example, healthy life expectancy is very, very low in those areas of the trust where there are high levels of deprivation. And we know that in working with our partners, there are things that we can do to impact on those things.
So this is quite a radical departure for the Trust, and it's really exciting because of that. But it's also building on a lot of what we know already. In most teams, people are already thinking about outcomes and well-being and working in partnership with other organisations. And we're going to bring all that we know from our work of improvement to help us with this work. Well, I think it all starts with thinking about who's not thriving. Where are the parts of our population where we're not really meeting their needs and where there's an urgency to do something different? And that's where this work differs. It doesn't really start from thinking about a service and how to improve a service, but it starts from the point of a population, really trying to understand what the assets are in that population and the community.
This is a real opportunity for us to think really creatively and be very innovative. I hope that some of those blockages and frustrations and barriers that we felt when we were trying to do things for our service users, this is an opportunity to break down those barriers by thinking about population. So that should be really good. Good for them, good for us. More interesting, more fun, more innovation, more creativity.